Tonight, using pharmacists for more than filling prescriptions.
We know that pharmacists have the training to be able to perform these tests.
How some Texas lawmakers want to expand some healthcare access through the pharmacy window. Plus, demanding action against violence on the southern border.
This is the latest sad chapter in a continuing saga.
Texas's U.S. Senator takes his concerns over cartels to the national stage after Americans are kidnapped and killed in Mexico. And later, a Texas lawmaker joins us live to discuss the rising number of bills filed over diversity in the workplace. Capitol Tonight starts right now. Thanks for joining us here on Capitol Tonight. I'm Karina Kling. The COVID-19 pandemic shifted more people away from the traditional doctor's office visit for testing and vaccines. Pharmacies became the go-to place for many. According to the Institute for Human Data Science, 90% of Americans who got vaccinated against COVID-19 did so in a pharmacy. The majority of flu and pneumococcal vaccines were also given at pharmacies during that time. And a poll from the Texas Pharmacy Association found that Texans see their pharmacist on average of 20 times per year compared to seeing their doctor only 4 times. They say pharmacies are also more accessible in socially vulnerable communities where healthcare may not be as available. Now, several lawmakers are working to make sure pharmacies remain a reliable place to go for vaccinations and medication long after the pandemic is over. Our Charlotte Scott reports.
We've been in business since 1941.
Tarrytown Pharmacy has been serving Texans for more than 80 years. Back when the medicine looked like this and the sign in the window was an ad for polio vaccines. Today, Ranan Ching is the pharmacist in charge here. Testing for the flu, strep, and COVID-19 is a big part of the job.
Right now, we can provide these tests, but there's not a really good mechanism for us to provide the medication that the patient might need.
But that could change this year. Houston Area Representative J.C. Jaton has filed a bill to allow pharmacists to test and treat. If the bill passes, Texans would no longer have to get their doctor to fill a prescription for flu, strep, or COVID medication.
Because there's reliable tests for those. And when someone has a symptom, they can easily get down to the pharmacy to get tested, and if tested positive, able to get the treatment earlier.
Another bill by Representative For Price would allow pharmacists to continue giving vaccines to all Texas children, including kids under 3 if they have a doctor's note. Before the pandemic, pharmacists could only give immunizations to kids 14 and older, with the exception of flu shots, which could be administered to children over 7. But when the COVID pandemic began in March 2020, the federal government issued a health declaration that allowed pharmacists to give immunizations to kids over 3 years old. The so-called PrEP Act is set to expire in October 2024.
It's important to have access and to make sure that we're eradicating and keeping at bay childhood diseases, things like the measles and polio.
According to the Texas Pharmacy Association, 90% of the population lives within 2 miles of a pharmacy. It's a convenient option for many to get a vaccine.
We're located pretty much everywhere in big cities, rural areas that may not have access to a great healthcare options, and we're open on nights and weekends, and we can really be that extra force to partner with.
Ching hopes lawmakers push both of these bills through so Texans can continue to get immunizations and medication at pharmacies after the PrEP Act expires next fall.
If we miss this opportunity, it really sets us back where we made so much progress with giving access to people.
For Capitol Tonight, I'm Charlotte Scott.
Joining us now to discuss this further is Debbie Garza. She's a pharmacist and the CEO of the Texas Pharmacy Association. Debbie, welcome to the program. Thanks for being with us.
Thank you. Happy to be here.
With what you've seen regarding the legislation that was just mentioned, how could continuing to be able to give vaccines to kids help with healthcare in Texas?
No, absolutely. Immunization rates declined during the pandemic and still are not back up to the pre-pandemic levels for children. So by allowing pharmacists to continue to provide vaccines, which they've been doing now for nearly 2.5+ years, that will actually help decrease the spread of infectious disease, make sure the kids are getting the vaccinations that they need. So I think it's very important that pharmacists be able to maintain the authority they've had through the federal PrEP Act.
Yeah, and just to be able to, give some more information on this, what is the training like to be able to give vaccines? I mean, not just anyone can do it, right?
That is correct. Pharmacists, as well as pharmacist interns and pharmacy technicians, all have to go through very specific training. It's classroom training, it's hands-on training, it's annual CPR, it's bloodborne pathogens, it's continuing education training. So pharmacists and pharmacy technicians and pharmacist interns who may be administering these vaccines have definitely had extensive training with regards to providing vaccines and what to do in case there's any adverse events or issues that come up.
You mentioned the vaccinations and that dropping during the pandemic, but some doctors may be concerned, and we've heard this, just that it would mean skipping well-check exams. I mean, what's your response to that in terms of making sure they're still going to see their doctor for these exams, but being able to do this in a pharmacy situation, pharmacy setting?
No, absolutely. Pharmacists do not fragment care. Pharmacists actually complement healthcare and should be part of that healthcare team. And as we've been required under the Federal PrEP Act for having the authority to administer vaccines for ages 3 and older, we have to make that parent or guardian aware of the importance of that well-child visit. So if anything, we can help drive people into that, regular doctor visit.
What about the legislation allowing pharmacists to test for illnesses like COVID, like the flu, and then being able to prescribe right then and there without having to go to see a doctor?
Right. No, great question. So first, pharmacists, if they have the appropriate CLIA waiver from the Federal Centers for Medicare and Medicaid Services and file that with the state public health department, we actually can do tests. We've been able to do tests. Pharmacists played a key role during the pandemic administering COVID tests. We've also been very fortunate during this pandemic to also be able to prescribe Paxlovid, which is an oral antiviral if they have COVID-19. And it's really important that for Paxlovid, if you have mild to moderate disease, you actually start on this medication within 5 days. When you talk about strep, flu, COVID, regular allergies, cold, they all have very similar symptoms. So with regards to pharmacists already being able to test for flu and test for strep, we also want them to be able to start them on the medication, prescribed Tamiflu if the patient is positive for flu, or the antibiotics if they're positive for group A strep. So really it allows patients to get the timely medication that they need with a single encounter and not having to have follow-ups with doctor visits, waiting for some time before they could see a doctor, or having more costly, money having to be spent with regards to then following up after a positive test with a doctor or emergency room or something like that.
Some legislation we will be continuing to follow throughout this legislative session. Debbie Garza, will get you back on. Thank you so much for your time.
Absolutely. Thank you. Appreciate it.
Taking on the deadly fentanyl crisis is top of mind for many Texas lawmakers. There have been at least 20 bills filed in the Texas legislature related to the opioid. Addressing the issue is also a top priority of Governor Abbott. But it's a national problem, and ending overdose deaths will require solutions on a national scale. Mike Valerio takes a look at efforts by lawmakers and organizations to fight the crisis.
It's a synthetic opioid intended to help patients manage severe pain, but fentanyl is now driving the drug overdose crisis across the country.
Fentanyl overdoses cause the equivalent of a new September 11th every 2 weeks.
Provisional data from the CDC revealing more than 2/3 of all overdose deaths are linked to synthetic opioids like fentanyl, leaving almost no community untouched.
It hurts every day.
It was something I had heard of, but not something I would have ever thought would have killed our child, ever.
While the federal government has declared the opioid crisis a public health emergency, there's a new push to target fentanyl and similar substances that are exacerbating the epidemic, including a proposed bill aimed at labeling Mexican drug cartels foreign terrorist organizations.
This problem is a national security threat. Fentanyl is a killer, and the people killing Americans reside out in the open in Mexico.
But some who have lost loved ones are taking matters into their own hands.
When my son died, I had never heard of fentanyl before.
Jaime Puerta lost his son Daniel to fentanyl poisoning in April 2020. He claims Daniel bought a fake pill from a dealer on Snapchat. Through his nonprofit called Void, Victims of Illicit Drugs, Puerta is working to raise awareness and change the conversation.
We have to look at it as a poison and not a war on drugs, but a war on fentanyl.
That was Mike Valerio reporting. Republicans are quick to blame President Biden's border policies for adding to the fentanyl crisis. Now they're calling on U.S. and Mexican officials to take military action against the cartels after 4 Americans were kidnapped in Mexico this week and 2 of them were killed.
This is the latest sad chapter in a continuing saga of violence and lawlessness. Right now, the Biden administration is not doing what it needs to do to secure the border and to keep dangerous drugs from coming into the United States. I would not take anything off the table when it comes to protecting American lives and protecting our own sovereignty. President López Obrador is concerned about
Additional details have been revealed about what the 4 Americans endured while they were being held captive in Matamoros. Gloria Pazmino is in Brownsville with more.
So I know this all hurt.
The mother of one of the Americans who survived a brutal kidnapping in Mexico says watching video of the abduction was terrifying.
Like trash, they throw them on the trucks, and I didn't like it, and I wanted to get to her.
Her daughter, Latavia Washington McGee, had traveled to Matamoros from South Carolina for cosmetic surgery, but they got lost searching for the clinic, and a group of unidentified gunmen fired on their minivan, loaded the Americans into their vehicle, and drove away.
Shahid and Zell and Eve, they all got shot at the same time, and she watched them die.
The friends were found days later at a home outside Matamoros. Shaid Woodward and Zindel Brown were dead. One official familiar with the investigation says their remains will be turned over to the U.S. government after a Mexican coroner completes a forensic examination.
Ultimately, we want to see accountability for the violence that has been inflicted on these Americans.
McGee and fellow survivor Eric Williams, who was shot 3 times, are already back in the U.S. where they received treatment at a Texas hospital. In Brownsville, Texas, I'm Gloria Pazmino.
Coming up next on Capitol Tonight, why a whistleblower settlement with Attorney General Ken Paxton could be in jeopardy. Plus, diversity in hiring, the latest move by state lawmakers to stop including such policies in public employment. Welcome back to Capitol Tonight. Here's a quick look at some of the other political stories making headlines across Texas today. Texas Attorney General Ken Paxton is telling pharmacies not to send abortion medication by mail. He joined several other states in a letter to various companies, including Rite Aid, Kroger, and Walmart, warning them that shipping abortion medication is illegal. This comes after Walgreens said it would not dispense mifepristone, a common abortion pill, in 21 states. Mifepristone is currently under review by a federal judge. A bipartisan bill in the Texas Senate takes aim at organized crime. Senators Pete Flores and Chuy Hinojosa want to make it easier for law enforcement to target financial assets of organized criminal groups engaged in racketeering. Hinojosa said it would help prosecutors build strong cases against gangs and target white-collar crime. In a Lubbock area, Republican state lawmaker wants to make affirmative action illegal in government employment and public college admissions. This comes after several university systems stopped enforcement of their diversity policies because Governor Abbott said that hiring policies that aren't based solely on merit violate state and federal law. The U.S. Supreme Court is also expected to make a ruling on affirmative action in the coming months. Joining us now to discuss the legislative session is Democratic State Representative Jean Wu of Houston. Good to see you.
Thanks for having me.
Thanks for coming in. The story that we just mentioned about there's just been a lot of controversy surrounding diversity and hiring this session. Governor says that it should only be based on merit. I mean, how do you see this affecting employment and hiring?
So it's really interesting because when we talk about diversity and inclusion programs, a lot of these programs were established to sort of undo some of the harmful practices that were done in the past, where schools had completely white faculties and didn't hire people from other groups, other ethnic groups, other races, and didn't make efforts to recruit from those communities. And a lot of what these programs do is simply trying to not repeat the mistakes of the past. Because if you only recruit from a certain group, you're not getting the best because you're overlooking all the other communities, all the other candidates. Whether that's intentional, unintentional, it's harmful to the state to make sure that we don't get the best from the entire community.
Yeah, I mean, should hiring only be based on merit, as they're arguing? If the argument is someone is better for the job,
right,
then should it be based solely on that?
Well, you never know if you're getting the best. And if you're just hiring on merit, that's fine. But if you have a system that is not designed to make sure that you don't find people from other communities, that you only recruit from a certain school, you only recruit from a certain place, and you end up with only, let's say, only white candidates, are you actually getting the best? Are you actually getting somebody, getting a candidate who is the best among the entire field? And you will never know that.
I know you're also really looking at Child Protective Services and ways to improve that this session and what we've seen over the past years. What are you looking at that would be kind of your main focus for reforming this system?
Well, we made a lot of the reforms in the law within the last couple of sessions, but the big item that occurs every session is money, money, money. And we've gone from a system that was very poorly funded, and we didn't have enough caseworkers. Caseworkers are overworked. Kids were getting ignored. To now we have the numbers for cases are going way down, and we're trying to get it to where the national average is. It's getting better, but that means that we're going to end up throwing more money at it, and that's in the end, it's going to be a better system.
How much do you think that's going to take, and is the will there to do that?
I think the will there is absolutely there. But how much exactly it's going to cost, we don't know. But for the most part, as we've been going through the budget for DFPS, for CPS, I think there's a pretty solid consensus that whatever they're asking for, we're willing to do it.
I also want to ask you, you represent the Houston area. Houston ISD is awaiting a decision from the Texas Education Agency about a possible takeover of district management. I mean, what would that mean for the school district, for students, for parents?
That's to be determined yet, because we've never seen a state take over such an immense school district. And we're talking about probably one of the better school districts in the entire state, and being taken over because the failure of a single school out of about 140 schools. And this is, I think, more or less a political game. And because these schools have continuously improved, and and we've said again and again, it's hard to undo decades of mismanagement, decades of discrimination and underfunding, and we've gotten there. But they're using technicalities to say, like, well, you didn't get there at exactly the right time, exactly when we wanted. And so I think the community's feeling pretty frustrated that the TA is about to blow up a school system that's doing really well because of a technicality.
And I know some of your lawmakers have filed legislation to kind of work on that and see where that goes. Representative Jean Wu, we'll have to leave it there. I hope you come back and talk to us more throughout the legislative session.
Thank you.
Thank you. A more than $3 million whistleblower settlement with Attorney General Ken Paxton's office could be in jeopardy. Attorneys for the whistleblowers who sued Paxton say they're headed back to court unless Paxton's office agrees to a deadline to finalize the settlement. The $3.3 million settlement was contingent on funding approved by state lawmakers, but attorneys for the whistleblowers said they're pulling back after the agency would not agree to a deadline to secure the money in the current legislative session, which runs through May. The case is pending before the state Supreme Court. Still to come on Capitol tonight, the largest global threats, what the U.S. Intelligence Committee's spy masters say they're keeping a close eye on. Hundreds of U.S. House members and staff had their personally identifiable information stolen in a breach. In a letter, a chief officer of the House says information from members' D.C. healthcare insurance service was compromised. The FBI says it's investigating, and as of right now, it does not appear any specific members were targeted. But House Speaker Kevin McCarthy is calling the breach a major concern. The intelligence community presented its annual assessment of the greatest worldwide threats to the U.S. national security. The nation's top spy masters testified today that Russia, the social media platform TikTok, and China are their greatest concerns. Cassie Simeon of our Washington Bureau reports.
As Russia's war against Ukraine grinds on, intelligence officials presented their annual report on the biggest global threats to the U.S. They told the Senate Intelligence Committee on Wednesday they see no sign of Russia backing down in Ukraine, but that Russia probably does not want a direct military conflict with U.S. and NATO forces and is suffering significant losses of troops and equipment.
We do not foresee the Russian military recovering enough this year to make major territorial gains.
The intelligence chief said China remains their unparalleled priority. They raised the alarm on China's technological competitiveness against America, including the popularity of the Chinese-owned app TikTok, which lawmakers and intelligence officials labeled a national security threat over its ability to control the data of users and shape public opinion.
I think the revolution in technology is not only the main arena for competition with the People's Republic of China, it's also the main determinant of our future as an intelligence service as well.
The Intel chief said the origin of the COVID-19 pandemic, which began in China, remains a puzzle. National Intelligence Director Avril Haines says while officials do not believe the virus is a bioweapon, the Intel community doesn't know if it originated in a lab or with an animal.
China has not fully cooperated, and we do think that's a key critical gap.
Republicans questioned Haines and the FBI director on classified documents found in the homes of President Joe Biden, former President Donald Trump, and former Vice President Mike Pence.
I have reviewed some of the documents personally, and my team, of course, has reviewed the documents.
Why have you not reviewed all of these documents? It would seem this would be a matter of vital urgency. I just think on something of such prominence and perhaps such significance that you both should review them. More importantly, this committee should review them.
The intelligence chiefs will be back on Capitol Hill on Thursday, this time to take questions from the House Intel Committee. In Washington, Cassie Simeon, Capitol Tonight.
And that is going to do it for this edition of Capitol Tonight. We are back tomorrow with the latest in Texas politics. Until then, thanks for watching. Stay safe and have a great night.
Thanks for watching our YouTube channel. And for more refreshing stories about your community, click the subscribe button right over here. You can also download our Spectrum News app to get live news coverage, weather alerts, and more wherever you are. And don't forget to tune in to Channel 55 on Dish and DirecTV for live local reporting every single day. We'll see you then.